My name is Steve Manley, past president of Sheffield Chamber and current Sheffield Chamber board member. I realise for many of you that this is new technology. Therefore, just to let you know that we have muted all of you apart from the 4 guest speakers. However, you may be wanting to ask questions as you go through this seminar. Therefore, if you look on the Zoom box, if you look down to the bottom middle, you will see a facility that says chat. If you click on that chat functionality, on the right-hand side, you will see another box appear that says Zoom group chat. And you can see that the Chamber's already put a note on there saying to ask questions. So further down at the bottom of that box, where it says type message here, we want this to be as interactive as possible. Therefore, please start to ask questions, and throughout the webinar, please continue to ask questions, and we will try to get through as many questions as we can. In terms of a general update, over the last month, the board has been meeting weekly via video conferencing to ensure that we are up to date with the latest government advice, and we are working closer than ever with the British Chambers of Commerce and the Chamber Network to assist in supporting our membership and the local business community. Late last week, I joined a webinar hosted by Dr. Adam Marshall, who is the Director General of the British Chambers. Adam has a direct line not only into government, but also into number 10. And they are working closely with the Chamber Network to ensure our thoughts and concerns are represented at the highest level. Adam opened that webinar with 2 key points which I would like to share. The BCC, or British Chambers, is here to represent and campaign for the interests of the Chambers and Chamber members, to add value to the Chamber membership as a whole. We as Sheffield Chamber feed into the BCC, and never have those 2 issues been more necessary as we face one of the sharpest and unexpected shocks that we have ever faced in our lifetimes. In terms of today, the most important aspect of our business and any business is the people behind it. In this unprecedented time, we need to look after our people now more than ever. With health and well-being being spoken about regularly, we believe it is our duty as a chamber to help every member and all your people within your organisation at this time of uncertainty. That's why we have put together a panel of experts to discuss the problems that your teams may be facing. The webinar has been created to help you look after your employees in this time of crisis, how to self-isolate and maintain good mental health, enhance business performance during these uncertain times, and also to understand your legal position. I am delighted to confirm that we have 3 experts with us today. We have Jay Biani, Senior and Managing Director of Biani HR and Employment Law. We have Richard Holmes, Director of Wellbeing at Westfield Health. So I'd like to welcome our first expert and panellist, Harry Bliss, Founder and Managing Director of Champion Health. I was initially introduced to Harry late last year when I was Chamber President, and Harry was a new startup back then and a local business based in Sheffield. I was blown away with his knowledge, passion and enthusiasm for mental health and well-being. Therefore, I'd now like to pass you over to Harry to quickly introduce himself.
Good afternoon, everyone. Thank you for the introduction, Steve. So it's great to have you all on the what is the 2nd webinar now for Sheffield Chamber of Commerce. And the most important facet of any business, without a shadow of a doubt, and that's been proven, especially during these unprecedented times, is the people. And we need to make sure that we can look after our people, not only from the moral case of doing the right thing, but also the business case, as I truly believe the businesses that are going to come out of this and thrive in the future are the ones that look after their staff, whether they're on furlough or whether they're still full-time working within your organisation. So I'm looking forward to sharing with you strategies, tools, tips that you can implement today, tomorrow and beyond.
Thank you, Harry. I'm now delighted to introduce Richard Holmes, who's been a Director of Health and Wellbeing at Westfield Health for over 2.5 years now. Over to you, Richard.
Thanks, Steve, and welcome everyone. Hopefully, sort of just reiterate everything Harry's just said there. We're here to support you in supporting your people in these really strange times that we're in. And I guess one of the things that you perhaps be useful when we're talking about this is to keep in mind, how do I need to look at my employees that are currently working from home, my employees that have been furloughed, and if I've got any key workers that still have to come into the workplace, because we'll need to deal with each of those different groups a little bit differently to support them through these difficult times. Back over to you, Steve.
Thank you, Richard. Our final panellist is Jay Bjarne. I first met Jay back in 2001 when Jay worked on a compromise agreement for me when Jay was at Watson Eason, based in Paradise Square. Jay is a highly respected solicitor with both in the regional community and also nationally, and is an expert in her field with over 25 years legal experience in employment law. So I'm pleased to introduce our final speaker, Jay.
Thanks, Steve. Hi, everyone. We've obviously been very, very busy over the last few weeks advising people about managing staff during, you know, what has been a real crisis for people. We've had to learn lots and lots of new things and try and interpret that for our clients. And I think the message that I really want to give is that, you know, your duties don't stop once you learn about how to furlough your staff. You've got to carry on looking after them, whether they're on furlough or whether they're self-isolating, you know, so wellbeing's at the top of the agenda now, I think.
Brilliant, thank you, Jay. As I mentioned earlier, we do want this to be as interactive as possible, so please think of questions that you'd like to ask the panellists as we go through the afternoon, and obviously make the notes on the right-hand side. Thank you to Jenny for sharing that link, which I'm sure will be really useful. Throughout the day, I have been email questions on LinkedIn, so I do have a list of some questions which I would already like to ask the panellists. Richard, if I can start with you first, please. Why invest in wellbeing now? Haven't people got enough on their plate at the moment?
Yeah, and that's common feedback we're getting from clients. And I was actually on a CBI conference call earlier this morning after the previous webinar we did. And what was being talked about there was that companies have had to spend the last week, the last fortnight, really focused on getting people back to home, getting them set up at home and adjusted to working from home. But now we've done that, what we really need to do is focus on their health and well-being, keeping them as fit and healthy as we can, keeping them as productive as we can, which Harry will touch on as well, but also supporting them because actually it's the right thing to do at this time.
Okay, brilliant. Thank you, Richard. And Jay, in terms of, Richard touched on working from home, what are the legalities with regards to working from home?
Well, lots of people, because they've had to do it so quickly, haven't had things like a home working policy in place. And I don't think it's too late to do that. I think all organisations ought to have a policy, try and agree that with the staff that are working from home. But the key is to have open communication so that, you know, there's a clear understanding of who's doing what, whether the job is altered, what the expectations are, what sort of times people are expected to work, because, you know, we're hearing stories of people working very excessive hours, and so just being really clear about what's expected, apart from, of course, you know, thinking about your data security and health and safety issues around people working from home, and just, you know, keeping an eye on all that.
Brilliant. Okay, thank you, Jay. I'm interested to know from the people that have joined this conference call or webinar, what experiences you find working from home? Is it different? How's it affecting you? What's changed? Do you have any expectations of your employees, or do you even have any expectations that your boss is placing on you? So again, please let us know not just any questions, but also your thoughts on how you're finding what's suddenly becoming the new norm. Harry, if I can bring you in, how do we as a business support our employees through this challenging time?
So I think the thing is that we are going to be constantly learning and evolving. We've got to be able to talk to our employees. That's absolutely vital. And what we touched upon earlier around not socially isolating, make sure that we're physically distancing, we need to maintain those communication channels. And I think that's the most important thing that I'm sure Richard and Jay will also share with me in saying this. We need to ensure that we're talking to employees consistently, employees are talking to us, and if they have any concerns, we need to ensure that we do have an open door policy. The next thing really is being able to be socially responsible in terms of what we're doing and making sure that we are prioritising our employees' well-being at this time. Now, they will be working hard, I truly believe. They want businesses to succeed, and if they don't want your business to succeed, there's a culture that might just need to be slightly amended within that organisation. Now, what we need to be able to do is, and Jay touched upon it earlier, is set key performance targets for people and make sure that we're not measuring the hours of work that they're doing, but making sure that they are still performing, because it's vital for any business to still be as productive as possible during this period.
Brilliant, thank you. Looking at the people on the list, I seem to recognise a couple of names, and I'm sure I recognise one name that works for a recruitment company. I'd be interested to know if you have any questions or any thoughts about how it's affecting your market, or any advice that you're giving to either clients of yours or also candidates. If I can, one of the questions that a friend of mine asked me, not necessarily for this, but he said, well, as a management team, we've got enough on our plate at the moment. What's the benefits of investing all our management time into health and wellbeing at this moment in time? Can I ask Richard to pick that one up, please?
Well, I wouldn't say investing all of our time in health and wellbeing, but certainly this is where leaders in businesses have got to pick up the mantle. And I think we're looking at sort of what I'd refer to as compassionate leadership, where we're understanding what people need. We're understanding the need to connect with people. We're also understanding the need to, importantly, lead by example, particularly in terms of how you're going to people are going to schedule their days, what you expect of them, what you'll give them psychological permission to do or don't do that's different from the norm, because people want to know that. They'll want to be guided. So an awful lot of management time needs to be spent on just making people comfortable with the new norm, the new working from home, creating schedules for themselves, as well as providing health and wellbeing support. Harry, do you want to add on to that?
No, I completely agree with everything you said, and I think that echoes with me around the compassionate leadership points within there. So I think you covered a really key point there, Richard.
Thank you. In terms of a question or a point that got raised by Kerry, which I think is extremely relevant in this moment in time, about communication with our teams. Jay, if I can bring you in terms of your team as an experienced leader, how are you communicating with your team at the moment, and any tips or advice on communication with the teams?
Yeah, so we're all working from home. I'm coming in on my own occasionally, but we've been using Teams. So if anybody's got Microsoft Outlook, it's free as part of your license, and it's a really, really good tool. So what we do is we're communicating messages through that with our different groups, so our HR group, our legal group, etc. But we also video calling each other at least once at the end of the day, just to check in with people and, you know, make sure that everyone's all right, because you can lose a lot when you're just emailing. I think seeing people face to face, well, even if it's not face to face, I think, you know, just seeing them, you can see everybody lighting up when they're kind of waving at their colleagues, and, you know, it's a good thing to do. And I think you learn quite a lot about what the mood is. You know, I always say that you should be taking the temperature of your workforce, you know, as a good leader. And I think that's quite a good way of doing that.
Brilliant, thank you, Jay. Rachel, just to pick up on your question about working from home and office furniture, I think Harry and myself have got some experience of this. Apart from being involved in the chamber, I run an office supplies firm, and obviously we supply all the elements that you mentioned there. And I think the challenge is the cost. We're hoping this is going to be a very temporary measure. And whilst you can still get desks, chairs, it's A, the cost to your business, and B, if people have actually got the space. But from an expectation point of view, Harry, I know you touched on this earlier, and you work from home, and I think you made some improvisers. What's your thoughts on that question, please, Harry?
So I think that what we need to ensure we are doing, and I saw someone mentioning risk assessments above. Now, the risk assessments don't need to be extremely extensive. All we need to know is, Are staff following the right procedures around making sure the monitors are at the right height so their neck isn't tilted down or upwards in an uncomfortable angle? People have the right back support, for example. So kitchen chairs are actually okay, as long as we have a pillow behind us and they're at the right height. So making employees aware of it, making them aware of the information. I'm sorry to not give your company a plug just here, Steve, but people can actually be ergonomically sound with the information out there. Because this might be 3 months, it might be 4 months, it might even be 6 months. We can't necessarily as businesses afford to invest in the most expensive high-end ergonomic equipment going at the moment. And so as long as employees have the right information as to how to work from home efficiently and healthily, then that is what will assist with the compliance, but also an effective musculoskeletal health strategy. Jay, can you touch upon a little bit more around the health and safety guidelines that businesses can follow?
Well, obviously we can't go out to everybody's home and carry out a risk assessment as you might normally, but somebody on the chat said that they were doing sort of virtual risk assessments, which is a great idea actually, isn't it? The Health and Safety Executive, you can look on their website and find lots of information about the sorts of risk assessments you need to do, and if you can do that over video, then that's a good way of doing it. Me being a lawyer, obviously I'm always one for saying we've got to keep a paper trail. So apart from doing the right thing by employees and making sure they're okay, you know, don't forget that actually that's the kind of thing that can bite you as an employer. So keep a paper trail of what you're doing to facilitate them. And then, you know, thinking about mental health issues. So many of our calls are about mental health issues anyway before this happened. So, you know, from a health and safety perspective, making sure that you're looking after particularly those people that are perhaps less or more vulnerable, or, you know, less robust. I think you really need to keep a check on them, because this is the time when people's anxieties are going to raise significantly.
Absolutely. Thank you to Kerry and Rebecca for answering my point from a recruitment perspective. That's very interesting to read. We've also got Sheffield Royalty on the line looking at, we've got Mr. Dakin on here who's asked Jay a question, which is basically, Andy, by the sounds of it, has got a limited company with Andy as the one employee. Can you furlough yourself as a limited company if there's just one employee?
Well, we're doing a webinar all about furloughing tomorrow morning, although I believe it's full, Sam, isn't it? But Andy, yeah, the short answer to that is you can furlough any employee that's on the PAYE payroll. If it's, so your, I don't know if your question, yeah, I mean, if you're paid through PAYE payroll, then you can furlough. But if you're going to carry on working within the business, then you can't, because that defeats the object of the furloughing scheme.
Okay, thank you. Hope that answers your point, Andy. Going back to healthy working, which I know we've touched on. Harry, how do you, from your experience, how do you encourage healthy working whilst working remotely?
So I think it's something that companies are learning about at the moment, but there is a lot of evidence out there. Now, the first important thing is to ensure employees can maintain a routine. We are creatures of habit as human beings, and we need to make sure we are maintaining the same routine. My girlfriend laughs at me that I always put my shirt on in the morning, even if I'm working from home, as I found that if I work in my pajamas, for example, then I'm not productive, I'm not in the right headspace, I'm not geared up for maximal efficiency. The second thing is then taking regular breaks, and I know Richard really does push this area, and whether we're working from home or not working from home, we need to take regular breaks, and public health recommendations are every 30 minutes. Now, when we look at cognitive functioning, so cognitive functioning is everything around productivity, from problem solving, memory, attention, concentration, everything that's crucial within a productive employee. Those that take regular breaks and those that are physically active are significantly more productive. So that would be my second tip as well. The third thing and the final thing is minimize distractions. And I think there are so many distractions within this world. Your mobile phone is probably the biggest distraction going. It's being able to switch off from that and be able to actually just do deep work whilst you are at work, and then being able to switch off. Now, if it's possible, try and have a mood anchor. And so what I mean by that is have an environment whereby you work in a separate room to where you watch telly, where you cook, where you sleep, for example. Not all of us are that fortunate. For example, at the moment, I am delivering it in my sitting room. But if we are able to get the mood anchor, so we associate that specific environment with work and the other areas with rest, then we're much more likely to lead healthy lives and productive lives as well.
Thank you, Harry. Richard, if I can bring you in, what are your top tips for what people can do?
I'm just going to echo everything that Harry's just said. It really is a case of we're now in the new normal, whether we like it or not. We are creatures of habit, as Harry said. So it's about creating a schedule that works for you. We do know from the past, people that work from home tend to actually work longer and harder than when they're in the office. So we've got to be careful about controlling that urge to do that. And it's really about building a timetable, a schedule for your normal working day that you can follow on a regular basis. I have time planned in my diary to go to the gym every day. I don't obviously actually go to the gym, that's not allowed anymore, but that's my space to go out and exercise. So I know that I've got it scheduled in. And a key bit of that scheduling that you've got to focus on is actually your sleep. And making sure that you're getting regular, good quality sleep by ideally going to bed and getting up at the same time each day. By that, I mean roughly within 30 minutes, variant from day to day, so that we've got that good quality recovery time to be able to cope that bit better with the stresses of the day.
Yeah, I after the morning webinar, I've completed one of Harry's mental health training exercises on his website, and the one thing that really struck me was about structure, routine, sleep. Can you just expand on that as well, please, Harry? Because I think that what the point Richard made is very, very important.
Absolutely. I truly believe that sleep is the foundation of our health and well-being. Now, just from an anecdotal perspective with myself, I require 7 to 9 hours of sleep per night for me to be anywhere near maximal productivity, but also in a mentally healthy state and happy and healthy. So sleep is absolutely fundamental. When we look at the research out there in terms of the sleep, an individual employee that sleeps poorly every single night of the week is 1,152% more likely to be absent than an employee that isn't. And again, when you look at fatigue-related productivity losses, for an individual employee that is sleeping poorly, it costs above £2,000 per year for them. So you can imagine in a company of 50 people, that starts to stack up. And we look at data breaches. There's so much done on data breaches within the workplace. Those most at risk of a data breach, lo and behold, are those that are mentally unhealthy and also those that are suffering with poor sleep. So it's really important. I can't echo Richard's sentiment around sleep strong enough.
Brilliant, thank you. Just to move back to from a law perspective, Jay, is there anything from a mental health and discrimination or practical things from setting expectations and rules, or anything else you can add from a legal side? Because I know, looking at the names, we have some employers on here today.
Yeah, I think what I'd say is just don't forget that your usual obligations apply. And probably, much more important at the moment, because you can't sit somebody down in front of you or walk past and see, how they're doing. From the perspective of people working from home, there are particular challenges that you ought to, as an employer, be looking out for. So this morning's webinar, somebody raised the issue of domestic abuse and how, that's really shot up. So for some people, it's really unpleasant working from home, and if there's an alternative, then you ought to try and seek that. For some people, they've got kids at home, and trying to work around having particularly younger kids at home is a real challenge. And so you've got to question whether that person can, properly work, or whether you need to look at some sort of alternative arrangement for them. And obviously putting in place reasonable adjustments. So if somebody's got a disability that you know of, or that you ought to know from the way that they're manifesting themselves, then as you would when they're within your workplace, you need to think about reasonable adjustments and ask them if there's anything that you can do. For example, altering the times that they're working if they're not sleeping very well, or altering some of the duties that they're doing.
Brilliant, thank you. I think it's worth noting some of the comments, and I'm hoping you can all see the comments. Kerry's made a very valid point about the Headspace app, which is with regarding meditation. And I know Rachel's obviously seconded that. So that may be something that we can help and advise on. In terms of knowledge and advice on the coronavirus, and I know there's a lot of knowledge and information on the television. Harry, can you just talk through the note you've just put on about the coronavirus advice tool that you've got on your website, please?
Yeah, so that's been developed by our GPs and academics from Leeds Beckett University and the University of Sheffield. And what we found was there's a lot of advice out there and best practice guidance, but there wasn't anything to put it all under one umbrella around how to boost your immune system, how to optimize your mental health during these uncertain times. And anxiety and stress is, lo and behold, skyrocketing at the moment. And I'll talk a little bit more later in the webinar about why that is and what we can do about it. But also how to work healthily from home as well, and so creating a home working plan. In addition to that, employers are needing support around health and safety guidance legislation, so we have partnered with an employment lawyer to be able to create advice for businesses and HR to be able to take forwards. So that's a completely free to use tool. It takes 3 to 5 minutes to go through, and we want to achieve our mission of changing and saving lives with it, so feel free to share with your team and your network.
Brilliant. Henry, obviously at Westfield, obviously the size of organisation with your experience, what are other organisations doing that you're aware of to support their people with regards to health and wellbeing?
Well, first of all, we're doing quite a lot. So I posted earlier on a link for you to go to the Westfield Health website, where there's lots of free materials to support, which will sort of back up the types of support that Harry's just been talking about. We're also offering organisations a range of free wellbeing services to help them support their staff in a number of ways. So if anybody's interested in that, just get in touch. One of the key things that's come up that I've seen with a number of clients I've been working with is they're really starting to try and develop a focused 3-month mental health plan. And that's really looking at what are we providing for staff now? Is it fit for purpose in the current situation? Is it working for people? And how are we communicating that to our people so that they know that it's available and there for use? A lot of organizations are also sort of, should I say, panicking a little bit and sort of just grabbing any service that they see that's out there that might support the staff. And quite often that then confuses staff because there's just too much there. So the first step that we're seeing most organizations doing now is checking what they already provide, making sure it's fit for purpose and it's working for people, before then sort of slowly adding in additional support as we go through this period.
Okay, brilliant. Another question that's coming to me via LinkedIn, Harry, is with all the uncertainty, anxiety levels are rising significantly across my team. What can I do to help my employees?
Yeah, so anxiety, let's sort of take a step back and talk about what anxiety is first of all. So anxiety is a feeling, it's a natural, normal feeling that everyone in this world has experienced or will experience in the future. And it is a concern about a worry about a threat or danger. And the reason why it was there is because of the fight or flight mechanism in the past. Now, it is completely normal to feel anxious and to have members in your team that feel anxious about the current circumstances. COVID-19 does pose a threat to our society at the moment, and we are in unusual circumstances. So I think the most important thing to do, and the most important thing for business leaders and companies to be able to do, is accept the fact that actually it's occurring and not fighting those feelings of anxiety. I think that's extremely important, especially within the male community as well, and being able to open up and talk about their mental health and their feelings. The second element that I would like to stress is around, you can only control what's within your control. And that seems like such basic advice, but it is human nature to be worrying about certain things that we haven't necessarily got control over. And that can lead to anxiety becoming more of a problem. And so I think it's really important to just take a step back if we are having those anxious feelings that are completely normal, and see what we can do within our control to be able to help ourselves and help our teams.
Okay, brilliant. Thank you. Right. I've not got any more questions that have come through to me. So I'm just going to ask the three panelists just to quickly summarise. So if anyone does have any questions, if you can quickly pop those on there. So Jay, just a quick summary. Any last final thoughts or advice from yourself, please, Jay?
No, I mean, I think that, you know, the wellbeing guys have covered it really well. I think from my point of view, I would just say that just because people are working from home doesn't mean that they can't be really productive. And if they're not productive, you need to be measuring why and what you can do to change that. And if that doesn't work, unfortunately, we're already seeing a few cases of abuse of self-isolation and working from home. And you need to jump on that fairly quickly, I think.
Okay. I think just from my side, and I mentioned this morning, what I've been doing is we need to be conscious of other people, and particularly people who are living on their own, whether that's young or old, it doesn't really matter. And I'm trying now on a daily basis to make 2 phone calls. We've all probably got lots of different people in our phone book, and I've been looking through and speaking to people who I've probably not spoken to for 6 months. So today. This afternoon, Jay, I spoke to Tony Gregory, previously of Keeble Horsam, who I know lives in Oxford on his own. I've not spoken to Tony for 6 months. He's actually self-isolating on his own for 12 weeks. And I think if we can just all think of the impact that a 5-minute phone call from the people on this call can have to people who we know are living on their own, who may be lonely. And again, the age is irrelevant. Just to make that extra effort and, you know, try and make somebody else's day, it can probably go a long way. Richard, if I can pass over to you to give us a bit of a summary.
I think from an employer's perspective, it's down to communication. Communication is key. Showing that empathy, showing understanding, showing compassion and supporting people. I think you've just touched on it there, Steve. From an individual perspective, a smile costs nothing. So when you pass somebody in the street, smile at them, say hi. Get that sort of, do your bit to get the community spirit going.
Brilliant. Completely agree. Thank you. Harry?
Yeah, I think I completely agree with all the comments being made there. And I think if there's one really positive thing to take out of this whole situation, it's the community spirit that's come out and the fact that people are really getting mucked in and helping out people that may be more vulnerable and less fortunate than they are. From a business perspective, I agree and I echo Richard's comments around communication. That is absolutely vital, that we, again, physically distance, but we don't socially isolate ourselves from the business. We've also developed an online mental health training course that, as of yesterday, has gone free of charge. So if anybody wants to access that, then we're doing a big launch later this week, but we will give you access to it immediately. So please don't hesitate to contact me on there. And finally, I think that we now know, if we didn't before, that the people are the most important aspect of our businesses, and we need to look to really prioritise them within this hard time.
Brilliant, thank you. Well, I sincerely hope you all found that useful. The Chamber will be sending you all a further email after this session with some follow-up notes. So I'd like to finish by thanking you all for attending. Thank you for the Chamber team for arranging this invaluable event, and a big thank you to Harry, Richard and Jay. Please do keep an eye on the Chamber website for all future events. That's something that will be continual update. Stay safe, everybody. This webinar will now be closing. Thank you very much for your time and hope you have a great day. Thank you.